Oh, I do believe that Puseletso is ready. Puseletso, a very good afternoon to you. So just give us a sense then in terms of that particular briefing that was chaired or co-chaired rather by our Health Minister, Dr. Motsoaledi. What are some of, the utterances that were made in that briefing to allay fears, of course, from South Africans following those findings by researchers?
Well, thank you so much, Unati. The Minister of Health, together with other stakeholders, they've just wrapped up a briefing on the issue of sanitary pads, containing the endocrine-disrupting chemicals. This is according to the study of the University of Free State. Now, we understand that the Minister said that has assured that the chemicals that are found in the sanitary pads are not harmful clinically. But I just want him to reiterate more on that issue. Minister, thank you so much for your time. I just want you to speak with our viewers as the SABC, assuring them that they should not have anxiety, because we understand that as the studies that you have done as the Department of Health, you found out that the chemicals that are found in these so-called sanitary pads are not clinically harmful. Let's talk about this.
Well, look, we took 2 weeks after the study with people wanting us to come out and tell people about the dangers they are facing. Some of us were surprised we took long, because these EDCs, we've been knowing for ages that they've been there. So we said, let's bring all the scientists, including international scientists, who must tell us what is this study all about and what are the facts. And the facts from scientists are that ECDs have been known from the 20s, which means it's 106 years now that scientists have been knowing about ECDs. And the World Health Organization said since that time they've been doing research to find if they've got any harm. They never found any evidence whatsoever. Secondly, they said finding these ECDs on panty liners and sanitary pads is not something that's new. They say from 2009, 20 articles of research have been written about whether when you find them on a panty liner or a pad, whether there is any trouble. None of those studies revealed any sort of trouble, because they are saying the presence of a chemical on a substance that human being use does not necessarily translate into a disease. Then thirdly, they said these products called ECDs are ubiquitous, meaning they are found everywhere where human beings are. They are found in foods, they are found in cosmetics, they are found in lipsticks, they are found in toothbrush, which you use every day to brush your teeth. They are found in water, they are found in the soil, they are found in agriculture where they are used as pesticides. I was just telling people that these bottles of water that are made of plastic here, they've got phenols, phenol resin, which is an endocrine-disrupting substance. So the fact that they say they disrupt is a potential disruption. And secondly, they say if you find them in certain amounts, then there is an international body that controls these amounts. So in essence, there's nothing to fear. But lastly, a very good lesson. You see, the people who did this study were sitting in a laboratory. It's analytical chemists. They deal with analytical chemistry. They don't touch human beings. They don't know what's happening in the human body. They are talking about what happens in a test tube. And believe you me, things that happen in a test tube, we cannot just automatically conclude that the same thing will happen in the human body. There have been many studies of something successful in a test tube to cure a particular disease or cause something. But when you do tests to living organisms, you start with animals. You start with animals, you test, and if it works there, it does not necessarily mean it's the end that it will be the same in the human body. Then you start doing clinical trials. The reason that clinical trials are done is to show that what I saw in the laboratory, is it like that in the human body? So many of them said no. They found them chemically on the pads that are used by women, but nothing was demonstrated in the human body. And the World Health Organization came in and said, no, we've been looking for this trouble, possible trouble, for more than 106 years. We didn't find anything. I'm sure you saw the director of chemicals and radiation at WHO, Dr. Richard Brown, who was here and said, no, we've been having teams for the past 106 years to look into these things globally. Globally, that means, because it's a global phenomenon, it's not only a South African phenomenon, but that the chemicals are also found on panty liners and sanitary pad. The problem is the study brought it as if it's a new discovery, which nobody knows about, when scientists have been knowing about them for ages. The SAHPRA, South African Health Products Regulatory Authority, even says, no, we're not regulating them because we didn't find any need, because the amounts are so small that there's no need for regulation. And so you saw all the other scientists, you had all the other scientists, especially here, gynecologists. Gynecologists are doctors who deal with women every day, obstetricians and gynecologists. They've got a society, and whose president was here, Professor Ishmael Borad. And he said, look, I've been working on women for decades. I don't remember meeting any women. Women use pads every day. Any woman come with symptoms to show that the use of pads has got any harm to them. Even the National Health Laboratory Service was here, where we test blood. They said, no, we asked them, in your test, have you come across a sample of blood from a woman who's using this pad showing any disease? They said, no, nobody sends such a sample, because doctors will only send a sample if there's a symptom or a sign. They don't just send samples at random. If there's a symptom or a sign that there's an illness, then doctors will send a sample. So they said, we have never tested any sample. Then Professor Borat said, no, we never sent any samples, because we as clinicians, you send samples for investigation if you find something during examination or during history. And up to so far, they said they've never found anything. And lastly, they said, actually, these endocrine-disrupting substances, they are found more in men than in women, because men are exposed to them from industrial exposure, from environment, occupational exposure, because they are working with hazardous substance everywhere. Because we told you these things are found in industry, they are found in paint, they are found in agriculture, they are found in food, etc., etc. So it's actually men. And now many people may believe hormones belong to women only. No, you also have hormones. There is a hormone called testosterone, which makes you differ from a woman. If that hormone is troubled, many things will start happening to you. The beard you are having will start going away. The axillary hair will start going away. The pubic hair will start going away. You won't get an erection, by the way. You may even develop breasts. So that can all, and they are saying, but when we do investigation, we found these chemicals more in men than in women. And up to so far, we haven't found them causing anything untoward.
Straight to the point, Minister. Thank you so much for your time. Well, that was the Minister of Health, Dr. Motsoaledi, essentially reiterating the fact that the women shouldn't fear anything, because it is found that this was not the first study to be found, and the findings are that this is not clinically harmful. But for now, it's back to you in studio.
Puseletso Mokoena, thank you so much for that, of course, coming to us live there from Pretoria following that briefing by the health cluster. Essentially, the health minister, Dr. Motsoaledi, is saying there that they were clarifying, of course, that study that spoke to the high levels of EDCs, that's endocrine-disrupting chemicals that were found in sanitary pads as well as panty liners, saying there that the numbers are very, very low, essentially not harmful at all, but going on, of course, to explain what exactly EDCs are and where they are found in our daily lives. We'll continue to unpack all of this and also continue to allay those fears in terms of what science has found, the WHO also investigating there.